Hello, so this is chapter 14, the under-recognized problem of steroid misuse. Introduction. Ancient Greek warriors ate deer meat or consumed special drink and potions to increase speed and endurance, and ate lion heart muscles to increase bravery. The Roman gladiators used potions to gain a competitive edge over their opponents. Anabolic steroid abuse reflects two social diseases: the emphasis on appearance, belief that it is acceptable to win at any cost. Arms race evolved between drug producers and those developing tests to detect these compounds. Introduction to anabolic androgenic steroids. Anabolic refers to drugs that increase the speed of tissue growth or repair, possibly through retention of nitrogen molecules in muscle tissue. Steroids refers to the fact that these compounds are similar to testosterone. These have masculinizing effect. These tend to exert their effects after puberty begins and can enhance the physical changes of puberty. Medical uses of anabolic steroids. Corticosteroids are most commonly used to suppress immune functions or inflammation. Anabolic steroids may be used to treat delayed puberty in adolescents and adjacent to the treatment of certain forms of breast cancer in women. Anabolic steroids also have value in treating AIDS-related tissue loss or osteoporosis. Why steroids and misuse? Athletes misuse of steroids because they increase lean muscle mass, increase muscle strength, and reduce the period of recovery between exercise sessions. Reverse anorexia nervosa, or muscle dystrophy, so they won't look small to others. Non-athletes may believe these drugs will help them look better. Law enforcement personnel expect an increase in strength and aggressiveness. The legal status of anabolic steroids. In the United States, anabolic steroids have been classified as a Category 3 controlled substance since 1990. At least 59 different chemical compounds have been identified as anabolic steroid, and their non-medical use is legal. So use or sale by individuals not licensed to possess and distribute them is a crime punishable by up to 5 years, or 10 years if sold to a minor. Scope of the problem of steroid misuse. Silent epidemic, so the true scope is unknown. Between 1.9 and 2.6 of high school seniors have misused anabolic steroids at least once. Preliminary evidence suggests the number of girls who abuse anabolic steroids is increasing. The median age of use is 18, and the typical male user is a well-educated Caucasian 30-year-old person with a white-collar job. Pharmacology of anabolic androgenic steroids. Anabolic steroids share chemical similarities to testosterone and can belong to 3 subgroups: compounds that are active when administered orally, compounds that must be injected into the muscle tissue, and compounds that are administered transdermally through a gel or a patch. Sources and methods of steroid misuse. Most anabolic steroids used in the United States are obtained from illicit sources, often from outside of the country. Internet pharmacies, sophisticated rogue chemists. In the world of professional athletics, there's also a thriving market for what are known as designer steroids. So terminology used by steroid abusers. I might not read all of this, but I'm going to read some of the terms. So you have blast and cruise, blending, blitz cycles, bulking up, cycling, and doping. So I'm going to just take a minute and let you read through these if you'd like. Okay, so let's see. And this is only one of 2, so we have some more terms in the next page. There we go. Injectables, megadosing, off-cycle, on-cycle, orals, pyramiding, shotgunning, and tapering. So I'll give it another minute or so. If you need to pause it, then go right ahead and pause it. Okay, so that's enough for that. As I said, pause it if you need to. The unknown hazards of steroid misuse. Therapeutic dosage can cause several side effects: sore throat, fever, vomiting, bone pain, urine discoloration, weight gain, headaches. Dosage of misuse, which can be up to 200 times the therapeutic dose, have not been adequately studied. Adverse effects depend on a large number of factors, including the following: route of emission, specific compound, dosage, frequency of use, overall health, and age of the user. Known adverse effects of anabolic steroids when misused, one of two. Effects on the reproductive systems for males, enlargement of breasts, frequent erections or lasting erections, unnatural hair growth or loss, reduced sperm production, degeneration of the testicles, enlarged prostate, libido changes, urination difficulties, impotence, and sterility. Effects of the reproduction system for females is abnormal growth of clitoris, irregular menstrual periods, unnatural hair growth or loss, deepening of the voice, atrophy of uterus, possible reduction in breast size. Known adverse effects of anabolic steroids when misused: liver, kidneys, and digestive systems, cardiovascular system, central nervous system, other steroid-related disorders, or possible foul odor on the breath, severe acne. Are anabolic steroids addictive? Psychological reliance, perceived benefits, and avoiding dependence. So are anabolic steroids addictive? Dependence on steroids relies on three pillars: psychological reliance on steroids, perceived past benefit from steroid use, and the development of withdrawal symptoms. Another important factor is the external feedback one receives. You look great. That reinforces steroid use. So this is the list of anabolic steroid use disorder in the DSM-5. So thank you for listening, and that will be all.